Do the first steps out of the bed each morning cause intense, sharp pain in your foot and heel? Does it feel like someone is stabbing you in the foot with a knife? You may have plantar fasciitis. Morning foot and heel pain is a distinctive feature of the presence of plantar fasciitis. Many of my patients will ask, why does my heel hurt so bad in the morning? In this video, I want to cover 4 key factors regarding plantar fasciitis. Number 1, I will share the physiological explanation as to why your heel pain is worse with the first steps in the morning, and I'll give you a couple of simple warm-up strategies to manage your morning pain. Number 2, let's make sure you actually have plantar fasciitis. So I will share with you the 3 signs to look for to confirm your diagnosis. Number 3, I will share with you the 3 primary causes of PF based on the most recent research. And I'll explain why people suffer for so long, because they are following recommendations based on old, outdated studies that are no longer relevant in the care of plantar fasciitis. Lastly, towards the end of the video, I will demonstrate 3 simple exercises and strategies to address each of the root causes, so stick with me to the end. I've got a lot to cover, so let's get started. I'm Dr. Angela, and I'm the Plantar Fasciitis Doc, and I'm all about helping you resolve PF at home. Now, let's get into it. The reason you have such excruciating pain with the first steps in the morning is because while we are sleeping, our feet and ankles naturally shift into a plantar flexed position where the toes are pointed downward. This position shortens our calf muscle group and Achilles tendon, and it also shortens our plantar fascia, which is the bottom of our foot, overnight. So when we take that first step in the morning, there is a sudden deep stretch of these tissues in order for your heel to make contact with the ground. This rapid change in tendon and fascia length causes an immediate sharp pain response, with symptoms lessening as you continue to walk. You may also notice the same symptoms after a period of rest, such as a long car ride or sitting at your desk for a prolonged period. The best way to decrease your pain is by increasing mobility and circulation in your arch and calf muscles before your feet hit the floor. Try rolling a tennis ball or a mobility ball along the length of your foot for 1 full minute before you take your first step. Use very light pressure, just enough to get the blood flowing to the soft tissues on the bottom of the foot. Another mobility technique is to try active stretching of your calf muscle group. Simply straighten your leg entirely and flex and extend your foot for 30 seconds. This action is sort of like ankle pumps, and it warms up your foot and leg muscles, tendons, and fascia. Try these tomorrow morning and let me know how that goes. Leave a comment below if you get some relief with your morning symptoms. As I mentioned earlier, I want to help you determine if your heel pain is being caused by plantar fasciitis. Plantar fasciitis is a degenerative condition in which repetitive microtrauma causes a structural breakdown of the soft tissues in the plantar fascia. That's a fancy way of saying if you put more stress on the soft tissues than they can handle, the result is a breakdown of those tissues and injury occurs. You may have started a new running or walking routine or increased your mileage. You might have gotten a new pair of shoes and the toe box was too narrow, or recently worn an old pair. In most cases, if you look in the recent past, you will surely be able to identify when you might have placed more stress on the fascia and initiated the breakdown. Here are 3 signs that will help you confirm the diagnosis. The first and most distinctive feature that we have already discussed is pain with the first steps in the morning or after longer periods of rest. This is the most common characteristic of PF. The second sign is pinpoint tenderness on the inside aspect of the calcaneus, your heel bone. The plantar fascia is a long, thick, fibrous band, and it originates at the heel bone. It fans out into the forefoot and attaches at the metatarsals. Take your finger and apply pressure at the inside aspect of your heel bone. If this is extremely tender, it is very likely that you have plantar fasciitis. The third sign is pain in the arch with extension of the big toe, which is pulling the big toe towards the knee. So pull your big toe up into extension. If this causes pain in the arch or in the heel, this is another positive test for plantar fasciitis. If you have 2 out of 3 of these signs, you very likely have PF. I wanted to share with you the 3 primary causes of PF based on the newest research. Sadly, most people are relying on methods that are ineffective and only prolong healing. In the United States alone, more than 1 million people receive treatment for plantar fasciitis each year. We used to think that most cases of PF lasted only a few months, but new research has shown that 80% of PF patients have had symptoms 12 months after the original onset. 50% had symptoms after 5 years, and a startling 44% of people studied had symptoms 15 years after the onset of the injury. In my opinion, the reason recovery rates are so poor is because for years patients have been given misguided information and outdated tactics that are virtually ineffective. Orthotics, night splints, rolling your foot on a frozen water bottle, static calf stretches, cortisone shots, and super supportive shoes are some of the biggest mistakes people make with plantar fasciitis. All of these methods are short-term band-aids and do not produce lasting results. These passive approaches change nothing about your condition. They do not increase strength, improve soft tissue quality, or make your foot more resilient. If you want to fix the problem, you need a rehab plan involving corrective exercises to rebuild your foot strength and flexibility. I'll share more about this later in the video. A perfect example of the type of outdated tactics given to patients is the foot orthotic. The reason most practitioners prescribe foot orthosis is because early research suggested that plantar fasciitis resulted from excessive foot pronation. So the vast majority of PF patients were given foot orthotics to limit pronation. But newer research shows us that pronation doesn't need correcting, and the amount of pronation does not determine the presence of PF. Also, prolonged use of foot orthosis has been shown to only further weaken the intrinsic muscles of your feet and leads to chronic PF. Other common treatment applications include super supportive shoes with arch supports and heavy cushioning. Many of the common shoe brands that claim to be the answer to your PF are actually making it worse. They have narrow toe boxes and elevation of the heel. Narrow toe boxes restrict normal toe splay, and elevation of the heel shortens our heel cord. You can imagine the damaging effects these design features have on our feet over time. The shoe industry is making millions off of people with PF. Shoes with excessive cushioning and built-in arch supports are contributing to your problem. Wearing footwear that supports the natural shape of your feet with wide toe boxes and zero drop, which is no elevation of the heel, is the first step to resolving your PF. Like these, Ultras and Limbs, for example. I have an approved shoe list in the description below of the shoes that I recommend for PF. Be sure you take a look at that and make sure you're not sabotaging your recovery by wearing the wrong shoes. Now, let's get back to the research. In an attempt to understand the true causes of plantar fasciitis, more extensive studies have been performed. The results showed that the factors most likely to be associated with the development of PF were weakness of the peroneal lower leg muscles, weakness of the intrinsic arch muscles, which I like to call your foot core, and calf inflexibility, so tight calf muscles. Surprisingly, peroneal weakness was the strongest predictor of the development of plantar fasciitis. The peroneal muscles are two muscles on the outside of the leg. They are major movers and stabilizers of the foot and ankle. They run down the lateral side of your leg behind our ankle bone and attach to your foot. The peroneus brevis attaches here on the outside of your foot. I have patients who complain of pain at this attachment site, and it is often peroneal tendinitis. The peroneal longus goes behind the ankle as well, and it is the longest of the two and attaches on the plantar surface of the foot at the first metatarsal. The function of these muscles is to evert the foot, so move to the outside, and plantar flex the ankle, which is to flex the toe. The peroneus longus is especially important in PF cases as it provides support for the arches of the foot. After studying these findings, I included peroneal strengthening exercises into my protocol and noticed significant improvements in long-term outcomes. The research also showed that restoring calf flexibility and ankle mobility was another important factor to correct PF. Prior to this research, strengthening the peroneals and foot core was rarely prescribed. And in my opinion, this is why PF patients suffer for so long. In this last section, I wanted to demonstrate 3 exercises that target these deficiencies in your foot and lower leg. The first exercise is calf raises with a ball between your heels. While performing a calf raise on a stair step, squeeze a ball between your heels. Squeezing the ball isolates the peroneal muscles and the posterior tibialis muscles, which are 2 important muscles for arch stability. Perform 1 to 2 sets of 10 to 15 repetitions 1 time per day. As you get stronger, increase to 2 times per day. To further increase muscle development, you can perform the calf raises on a slant board. Progressing to performing on a slant board increases the load and further increases strength. The second exercise I recommend is kneeling ankle rocks. This exercise helps to increase ankle dorsiflexion and improves calf flexibility. Kneel in front of a wall, shift your weight to your front foot. Attempt to touch the wall without raising your heel. Hold for 2 seconds and repeat 15 repetitions on each side. Perform this exercise 1 time per day, and as your range of motion improves, increase to 2 times per day. The third exercise to help strengthen your foot intrinsics and peroneal muscles is to jump rope or perform leg hops. The action of jumping rope improves elasticity and resiliency of your lower leg muscles and helps strengthen your arch muscles. Jump on both feet for 30 seconds, then rest and perform 3 to 4 sets. Wear your wide toe box shoes in the beginning, but to further increase strength, try jumping barefoot. Exercising while barefoot is an excellent way to increase foot strength and resilience. You may be thinking that some of the suggestions in my videos are completely opposite of what you have been told regarding plantar fasciitis. I have based my entire PF protocol on the latest, most comprehensive studies. The evidence is clear. Focusing on correcting the weakness and deficiencies in your feet and lower leg is the only way to improve outcomes and resolve this debilitating condition. To find my complete strengthening and mobility protocols, be sure you download my free guide where I show you the exact steps to resolve your PF at home. Also, be sure you watch my next video on more strategies to resolve your PF.